Good afternoon, and welcome to today's Side by Side with the Division of Mental Health, Developmental Disabilities, and Substance Use Services, Improving Our System Together monthly webinar. Before we get started, here are a few reminders about the webinar technology. Please make sure you are using a computer or smartphone connected to the internet, and the audio function is on and the volume is turned up. Please make sure your microphone is muted for the duration of the call unless you are speaking or asking questions. Questions can be submitted at any time during the presentation using the Q&A feature located on your control panel. We will answer as many questions as time allows after the presentation. American Sign Language interpreters and closed captioning options are available for today's event. The American Sign Language interpreters for today are Danette Steelman Bridges and Susan King Lanier. For closed captioning options, select the closed caption feature located on your dashboard. To adjust your video layout and screen view, select the view feature located in the top right-hand corner of your screen and choose the view that works best for you. Today's agenda topics include introductions and MHSU IDD TBI system announcements and updates. Our focus today is supporting choice and inclusion. There will also be time for questions after the presentation. At this time, I'd like to turn it over to Renee Rader, Deputy Director and Chief Operating Officer for the Division of Mental Health, Developmental Disabilities, and Substance Use Services.
Thank you, Dina. Hi, everyone. Good afternoon. I'm Renee Rader, and I have been with North Carolina DHHS for over 13 years now. I have been in the field of mental health, developmental disabilities, and substance use services for over 30 years. I've been here at DMH DDSUS since 2019, but I have been working directly as Deputy Director and Chief Operating Officer for the past year and a half. My role here is to support our director, Kelly Crosby, in any way that she needs me to support her, including helping with webinars and meetings when she's not available. And also I'm responsible for all of our internal operations and strategic business leadership. Our focus today is on supporting choice and inclusion, and I am so happy to have 4 guest speakers here that I know very well. We have Ginger Yarbrough and Tina Barrett, who are going to talk to us today about Inclusion Connects. Both Tina and Ginger have many, many years in the field supporting people with intellectual and developmental disabilities and traumatic brain injury. And they both started around the same time with our division in 2023, but they are going to talk about that in a little bit. I'm also really happy to have with us Kenneth Bossell and Nicole Ness, both of whom have numerous years of experience in the field. Kenneth has 15 years of experience working with people with IDD in community-based settings. He's been with DHHS for over 10 years. And then Nicole Ness, who is a licensed clinical social worker who has been in the field of adult mental health for 18 years. First, though, I would like to give some system updates to share with you the work that's happening within our division, and also talk about how you can have your voice heard. Next slide, please. So this is the structure of our monthly community engagement. This model is our commitment to transparency in our work, to build collaborative spaces for community members and stakeholders. So it starts with this webinar, this side-by-side webinar, and then the topic cascades down to all 4 of our standing meetings that we have every month, which is our state CFAC, our LME MCO clinical meeting, our provider and provider associations meeting, and the meeting that we have with the NC Healthcare Association. We also have specific advisory groups for each of our investment areas. So that's workforce with peers, workforce with direct support professionals, child behavioral health, crisis systems, and supports for justice-involved individuals. This is a space where you can provide direct feedback and input in how the investments are designed and developed. If you're interested in joining, we'll drop the link in the chat. We'll also be uploading this slide deck to our website. So if you'd like to register later, you can click the link in the corner of this slide. And we really hope you'll consider joining us. These work groups are very well attended and one of our primary ways to ensure that stakeholder voice is heard. Next slide, please. So this slide is on Samantha R. So the North Carolina Department of Health and Human Services and Disability Rights of North Carolina recently announced an agreement in the Samantha R. et al. Versus NCDHHS and the state of North Carolina litigation. This development signifies the commitment of both organizations to ensure all North Carolinians with intellectual and developmental disabilities have the resources they need to live healthy, independent lives in communities of their choosing. NCDHHS and Disability Rights North Carolina will jointly discuss the consent order in the Samantha R case during 2 upcoming webinars this Thursday and Friday. The webinars will present the same information, so you only have to attend one, but you're welcome to attend both if you like. We'll drop those registration links in the chat, but again, if you want to register later, you can click the link in the corner of this slide once the deck is uploaded to our website. Next slide, please. So we are pleased to announce $15 million investment in 9 behavioral health urgent care facilities. So behavioral health urgent care facilities, or BHUCs as we like to call them, provide an alternative to emergency departments and offer 24-hour access to mental health specialists who can assist with diagnosis and assessment, medication management and treatment options, and getting people the right care at the right time and in the right setting. So if you're familiar with a medical urgent care model, this is essentially the same thing except for folks who have behavioral health conditions. These behavioral health urgent care facilities will be in Alamance, Buncombe, Caldwell, Haywood, Onslow, Pitt, Rockingham, Rowan, and Vance counties. These locations were chosen based on several criteria, including regional data on the number of individuals waiting for behavioral health care in emergency departments, proximity to crisis services, and partnerships with pre-existing community services. Next slide. We are also announcing a $22 million investment in 8 community crisis centers and peer respite. So we're investing in 5 new community crisis centers for adults in Alamance, Forsyth, New Hanover, Pitt, and Vance counties, and 3 new centers for children in Gaston, Pitt, and Vance counties. These centers will provide short-term inpatient mental health stabilization and substance use detox. The new investment will create an additional 60 beds for adults and 44 beds for children, increasing the state's capacity for community crisis stabilization by 20%. We're also partnering with Alliance Health and Promise Resource Network to add a 4-bedroom peer respite program in Wake County. This will be the 3rd peer respite program in North Carolina. So community-based peer respite programs offer 24/7 access to peer support specialists who provide support from the perspective of people with lived experience. Very excited about that. Next slide. So tailored plans and accessible communication campaign. Tailored plans, if you don't already know, are a new kind of North Carolina Medicaid managed care health plan for beneficiaries with a serious mental illness, a serious emotional disturbance, a severe substance use disorder, an intellectual or developmental disability, or a traumatic brain injury. Next slide, please. So our accessible communications campaign recently released bilingual accessible resources for people who will be impacted by the transition to tailored plans on July 1st. The toolkit includes a PowerPoint essentials deck that communicates key information, answers to FAQs, what to expect ahead of the tailored plans launch, and resources to help North Carolinians navigate the process. A 1-page bilingual flyer to let people know what actions they need to take before tailored plans launch. It also includes social media content and graphics in both English and Spanish. It includes a new tailored plan webpage with key dates and bilingual resources, and a communications toolkit with accessible resources. Next slide, please. So we want to hear from you. This is our priority communication survey. We're conducting a survey to help us determine the information needs of stakeholders with regards to tailored plans and tailored care management. This is being done in partnership with the Division of Health Benefits and Nieman Collaborative. The results of this survey will help us to prioritize the development of communication materials. So let us know what you need. The survey itself only takes a few minutes. You can access it by scanning the QR code in the slide, or you can use the link that Badia is going to put in the chat. And that is all of the updates for today. I'd like to turn it over to Ginger Yarbrough and Tina Barrett for their Inclusion Connects presentation.
Thanks, Renee. All right, we can skip to the next slide. All right, so the department launched Inclusion Connects on March 14th, which was in the middle of Developmental Disability Awareness Month. This is a cross-divisional initiative and involves DMH, DDSUS, Medicaid, and others, as we're trying to make the system easier to navigate for everybody. So we look at this as really an evolution of the IDD system, trying to demystify, increase access to services to people with IDD so that they can really live and thrive in the community they want with the people they want. So again, increasing choice of housing, choice of services, and choice of providers. And part of this work is, when we're talking about access, is also around improving direct support workforce. Next slide. So we'll go through the three main areas that we're looking at. We'll start with access to services. As many of us are acutely aware, there are 17,500 plus people on the innovations waitlist. I do want to highlight, for the first time, many people on the wait list can actually receive services while they wait. So July 1st, 2023, the 1915I option became available to people with IDD. Also, tailored care management is available for people with Medicaid as well. And this is really a big deal because before, there were very, very few services available as you were waiting for that innovations waiver slot. And part of Inclusion Connects is really ensuring people are able to get to those services. So knowing who to ask, how to get there, what the process is, and really being transparent in that. Access to services also includes supporting people who would like to transition out of institutional settings or move into the community, maybe out of their family homes, if they so choose. And this means starting with understanding what housing options are available and what resources are available for those types of transitions and living arrangements. And then the third area is the DSP workforce. A big part of access, we can write a plan, we can get an authorized service, but we have to have a workforce that can support those services. So a big part of what we're working on is building a robust workforce of well-trained, high-quality DSPs. And I think my slides may have gotten out of order a little bit. So we'll jump to the next slide. All right. So this one should have been before, and I apologize for that, but we'll keep on rolling. So tell you a little bit more about what Inclusion Connects is. We have 5 key points. First is inclusive policymaking, underlining the importance of having everyone at the table. And that means having people with IDD, families, caregivers, and members of the support network in the decision-making process to make sure that our policies are meeting the needs of the population that we're serving. One way that we're ensuring that this happens is to launch our new Inclusion Connects Advisory Committee, which will be jumping off this month. And you might hear it referred to as the ICAC because we always need more acronyms. The next is a centralized access to resources. making sure people know where to look to get the information they need. If you Google IDD services in North Carolina, you will end up in 100 different places with 100 different pieces of the puzzle. And what we're trying to do with Inclusion Connects as a website is to have it as a hub so that you know that that's the source of truth to connect you to the services that, that you need. And to make sure that it's in a user-friendly format as well, so that it also has accessible communication. Let's see, streamlined access to community-based care, making sure that people know what the full spectrum of community-based settings are for people who want to live in the community and know how to get to those. I'm going to skip down to the last one, statewide accessibility and awareness. You know, helping everybody in North Carolina thrive is super important. And part of that is making sure people are aware of the services and supports that are available. Now, jumping back up, supporting our DSPs. Our DSPs, we want to make sure that we're improving their career opportunities and benefits to be a DSP. So people know that that this is a viable career path. And with that, I am going to turn it over to Tina so that she can share a little bit of that exciting news.
Thank you. It is no secret that within the state, we are in need of direct support professionals, and the state is in the process of developing a strategy so that we can help recruit people with intent into the field of IDD. As we often know, when you work in that area, there's a lot of folks who fall into the profession accidentally. So they don't necessarily know what the job is. They don't necessarily know what the work is that they're expected to do. So we're hoping to create a pipeline of recruitment that brings people into the field with intent, so they have a better sense of what is expected of them. The turnover rate amongst DSPs in 2021 was 43%. That is really high. The people on the innovation waiver are not getting all of their services. So not only do we have 17,000 plus people on the wait list, but we also have people who are receiving the waiver that are not able to access all of the services that have been authorized because of the workforce shortage. One of the things that we have noted is that of the IDD providers that were surveyed, which is part of the NCI survey, 66% have turned away new referrals and 34% have discontinued services for people. Next slide, please. The state is working to help build a DSP workforce, a robust workforce. Our year one initiatives, again, focus on the awareness and recruitment campaign, bringing people into the field with intent. We're also looking at developing a core competency curriculum, which will include the essential skills and knowledge for DSP professionals, so that when they're hired, they can hit the ground running and be right in there working and learning the people that they're working with, so that the skills that they need to learn on the job are person specific. We're also helping develop a pipeline and an initiative so that folks that are interested in expanding beyond just working as a DSP have an opportunity to further their education. We'd like to start with a DSP certificate program that includes a hands-on practicum, as well as looking at potentially expanding beyond that. Our year two initiatives do focus on supplemental benefits, which would be some additional perks and benefits to support the DSP staffs provided through the provider agencies where they're working, including people who are self-directed or employers of record. We're looking at opportunities to enhance the workforce through the use of technology, as well as leveraging some of the systems that are already in place, and the development of a DSP directory program to help match providers and DSPs to each other. So we're looking at providing all of those services. The outcomes that we're expecting would be increased community living support utilization rate, as well as a decreased wait time for services because of an increased DSP availability. Next slide, please. Thanks. So I think Ginger mentioned the ICAC, but also as part of the community work that we do here is part of the DSP Workforce Advisory Committee that does meet once a month. We have a great committee in place already. We're always looking for more folks to join us. So the advisory committee does advise and inform us on some key aspects of the evolution of our workforce. It is chaired by DMH DDSUS, And it consists of representatives from consumer and family advisory committees, provider groups, as well as actual DSPs, as well as for folks who are living with IDD. So it does meet monthly, and our meeting topics involve engagement with our DSPs, the recruitment and training, the benefits, technical utilization, and establishing the directory. We did have a survey that recently was released and closed. We're in the process of compiling those survey results from DSPs directly to help direct some of the work that we're leading. So we'll be reporting on that at our next meeting. Next slide, please. Oh, okay. So I am going to hand this over to Nicole and Kenneth to talk about the individual placement supported employment program. Thank you.
Thank you so much, Tina. Thank you everyone for joining today for our presentation on individual placement and support, IPS supported employment program. Next slide, please. These are 8 aspects of our lives that need nourishment in order for us to be well and to stay well. These are spiritual, intellectual, financial, environmental, occupational, physical, emotional, and social aspects that all need nourishment and are all areas that are interconnected and are all impacted by positively or negatively with everything that we experience. Next slide. When you think about employment, think about your own experiences with employment or the people that are closest to you. And think of the ways that work impacts your wellness. A few examples of why we work is we get money, we get an income, and that helps us obtain the things that we need and want. It provides us a sense of meaning and purpose, especially when that employment is something that we chose that is important to us. And it improves our social network. We're around other people. We have the potential to make friends. And when we don't have work or we lose work, it's very likely that we'll experience feelings of worthlessness, be isolated or alienated from others, experience lower self-esteem, increased psychiatric problems, or a recurrence or new psychiatric problems in our lives, increased physical problems, and increased substance use. Next slide, please. I want you to think to yourselves for a couple of seconds when you think about a person who is living with serious mental illness and whether or not they want to work. What do you think the percentage is of people with serious mental illness who want to work? Would that be 5 to 10%, 20 to 25%, 35 to 40%, or 65 to 70%? Give you just a moment to think that over and why you may think that. And I want to let you know that the answer is actually D, 65 to 70%. And if we move forward to the next slide. Further research shows that less than 15% of people with a serious mental illness are currently working, and less than 2% of people are receiving supported employment. So we have about 60 to 70% of people with a serious mental illness who want to work, but are not in the workforce and are really not being helped. And we'll talk later about some of those supported employment services that are available. So why focus on working when it comes to a person who's diagnosed with serious mental illness? It is an essential part of a person's recovery. And for those who are receiving treatment, it can really have a great impact on the gains that they're already making towards their own recovery goals. It has the potential to reduce hospitalization and crises services, better control symptoms that somebody may be experiencing, and reduce substance use. It may also help somebody, if they have meaningful employment, there's more of an incentive to not lose that employment, which may create more of an incentive to work hard with a treatment provider or other forms of recovery to further control those symptoms and make choices to engage in trying to reduce substances. Another focus of working can improve social networks, improve the quality of life while also decreasing loneliness, which is especially important for individuals with a serious mental illness who are transitioning or newly transitioned into housing in the community. Also, really improves self-esteem and increases income, as I mentioned earlier. I'm now going to pass it on to my colleague Kenneth to finish off our presentation.
Hey everyone, so on this slide, you'll see what is IPS. And Nicole was talking a lot earlier about how employment is really important to people's health, well-being, all that kind of thing, those 8 different elements that she showed. IPS, or Individual Placements and Supports, is an evidence-based practice that supports people who are working age, so 16 years of age and older, with severe mental illness, and it helps people find competitive employment and jobs of their choosing. And it provides ongoing individualized support with a focus on employment and education. So again, all of those kind of real great benefits of employment, IPS, or Individual Placements and Supports, is one vehicle to get people from into work, basically. What you see at the bottom too is what makes IPS stand out compared to other support employment services is that it has that behavioral health treatment component, it has benefit counseling component, and a connection to the Employment and Independence for People with Disabilities offices. And that Employment and Independence for People with Disability offices, that's the new name for the Division of Vocational Rehabilitation. And it's just a name that really conveys the work that happens in those vocational rehab offices. So next slide. So what is IPS? And you'll see the 8 practice principles of IPS. The first one is focus on competitive employment, which was mentioned on the slide previously. And competitive integrated employment really means working alongside people without disabilities and being compensated at or above minimum wage, and really in a similar way that people without disabilities get paid for that same work. You also see this integration with behavioral health, which was also one of those really great things about Individual Placements and Supports. And again, IPS supports people with mental health support needs, and often people who are using employment supports with mental health support needs are also using other behavioral health services. So this integration is really to ensure that the person is being supported in a consistent and meaningful way. So we're not having different providers supporting someone in different ways that may be undermining each other, but really working together based on the person's needs, preferences, things like that to get to the best place. Zero exclusion is the next one, and this one is really powerful, and it means that if someone is interested in work, we want to get them to the IPS team or that local Office of Employment and Independence to start their employment journey. We don't want to put up any self or bureaucratic inflected barriers to slow down someone's job journey. So an example could be a professional thinking that someone cannot work because the person's not adhering to their treatment, or if the person's actively using substances. In those situations, if the person is interested in work, we really want to get them to the people who will support them on their work journey. So again, being those Individual Placement Supports teams, as well as the Office of Employment and Independence. You'll also see the benefits counseling. Again, this was on the previous slide, but it's really to help people understand how their benefits may be impacted by work, and also, more probably importantly, how they can work and continue to maintain their benefits. What we hear a lot on the mental health side, as well as on the intellectual development disability side, is that people think that someone shouldn't work because it might impact their benefits. That benefits counseling is really there to make sure that people are informed and that they can take actions to be able to work and sustain their benefits. Client preferences is another thing that I skipped over, but super important. And it means that the IPS services and teams want to help people find jobs based on individuals' wants, needs, and preferences in order to find the person a successful job, one that they're motivated by, and one that they're likely to keep going forward with. And my team just pinging up, so I should have muted that. So I apologize if you hear those pings, but next slide. So again, this slide right here really goes back to that individual or client preference. So the goal of all the systems and system pieces is to work together so the person can realize their recovery and employment goals. So here you see the person in the middle. We have the Office of Employment and Independence for People with Disabilities on the left, the LME MCO on the right, providers at the bottom, and then Medicaid and state funds at the top. So individual placements and supports is paid through something called NC Core, which is the payment methodology, and it's a braided funding that occurs between Medicaid and state funds, as well as the Office of Employment and Independence for People with Disabilities, and the LME MCOs really are a key piece in kind of overseeing and operationalizing those Medicaid and state funded sides. And then, of course, working with the EIPD office to also work on that as well. And then the providers oftentimes link between these different services to support the person. And really going back to that client preferences, the person is really driving the work that's happening based on their recovery and employment goals. And we can go on to the next one. So this is thoughtful questions on building interest and motivation for work. And really, instead of just saying something like, do you want to work? How do we ask questions that really elicit reasons why someone may want to work to help them decide that work is a great option for them? So you'll see one, why would you want to have more money? Something like that. What would you like your life to look like in 10 years? So really talking about work and the benefits of what money can do and how that can give you more independence in your life, give you more choices, instead of just referring to work as work. So you'll all have these to utilize as needed. And then next slide. And this is really kind of mapping out where we are across the state in terms of IPS teams. So you see there are 30 IPS teams spanning the mountains to the beaches. Of course, the LME MCOs as well as the EIPD offices are always looking for more IPS teams or teams to expand or more integrated teams. You'll also see as of December 2023, there's an average number of 1,145 people receiving IPS services. And as of December of 2023, the average number of people receiving IPS who are working was 40%. So that's really positive, right? More people are accessing IPS, more people are working, and that's happening throughout the state. So really exciting stuff and really key to people's recovery. Next slide. And this one is really how you can contact people if you're interested in IPS. And I also want to give kind of a shout out to all of our LME MCO partners. So you'll see Alliance right there, but Damali Austin at Alliance, Katie Hewitt at Trillium, Tina Wallace at Partners, and David Boyd and Angela Canada at VIA. They're all great partners and really invested in expanding employment opportunities for people with mental health support needs. And again, if you're interested in IPS, if you're ready to work, if you know someone who may be looking to get into work, please contact your LME MCOs and ask about individual placements and supports, and they can help walk you through what those next steps would be. And I think that's all of our slides, but thank you so much for having us today.
Thank you, Kenneth, and to all those who presented today. We've got a few questions from the audience that I will be sharing with you all. So first one, I think primarily for you, Ginger, but I invite all of our panelists to respond to it. So how can individuals who do not qualify for Medicaid get home and community-based services like those offered under 1915I?
So this is a bit of a tricky question. There are some very limited state funded services, and it depends on which MCO you're at, which ones they provide. But one of the things that we are hoping through our support with accessing 1915I is to move people who qualify for 1915I to the Medicaid services and off of the state funded services that they're getting, and free up those state funded services for people exactly in that situation.
I think that's a great answer, Ginger. And just like a historicalness of it, there were quite a few people who had Medicaid who are using the majority of the state funded services.
Right.
So really what Ginger was saying is shifting those people over to a Medicaid service should hopefully free up more state dollars. There are also different services through the Division of Employment and Independence for People with Disabilities. So if someone's interested in work and doesn't have Medicaid, the LME MCO through their state funds is the, and then also partnering with those EIPD offices would be a great place to start as well.
Thank you both. Next question. Again, Ginger, I'll direct it to you, but invite all of our panelists to respond. What is the department doing to help direct support professionals earn a livable wage?
So I think the first thing to acknowledge is in the budget, there was an increase in innovations reimbursement rates. So those funds were actually intended to be for the benefit of the DSPs. So those have been getting out there. We continue to look at some more creative ideas, and part of that work is through our DSP workforce initiatives. So if you remember, we were talking about creating core competencies, creating a micro-credential program so that this is a career ladder. And part of that work is exploring how do we, get those dollars into the person's pocket. So how do we incentivize people for participating in that? So those are some things that we are working on right now.
And then the governor's budget or proposed budget that again would have to be approved by the state, I think is $180 million that's being asked for to really stabilize direct support staff on the IDD side, mental health side, physical health, all of that. So that's really exciting that this is continuing to be talked about. Of course, that's not in effect yet. It will have to be in the budget to be approved.
Thank you both. This next question is for Nicole. So Nicole, what is the overlap between peer support and IPS and DSPs?
Thank you for that question. A very important point about IPS is that part of the policy is that there's a requirement for a full-time peer support specialist to be on the team specifically to use their unique role to help a person identify what a meaningful work goal would be for them, where they would want to work in the community that would be meaningful, and to use their own story of being in recovery, having a serious mental illness, or somebody with a substance use disorder, having to go through challenges and persevering and finding their own work, and going through the recovery journey, and help that person with that lived experience, and to help them establish tools and strategies that they can use to maintain that work and to be successful.
Thank you. Okay, I think we have one more question. What are the service, and again, this is for all the panelists. What are the service differences between Medicaid Direct and tailored plan for the IDD population?
I don't think we have a Medicaid colleague on, do we?
We don't. I didn't see anybody here.
Okay.
So we might have to take that one back.
Yes, we'll take that one back. I'll follow up the person who submitted that question. Those are all of our questions for today. I don't know, Ginger or Kenneth or Nicole, if you all want to maybe offer any closing remarks. Otherwise, thank you all for being panelists today.
Yeah, I do want to mention when it comes to tailored plan launch that you will keep your spot on the wait list. That will not go away or change. So just want to make sure people know there's nothing that they have to do in that aspect.
No, I just thank you for having us. We're excited for all of the work that's being done to expand employment opportunities for people with mental health support needs in our system, and really want to get to a place where, we can all see employment as being key to recovery and helping people get to those jobs as needed. But again, thank you so much for having us today. Nicole, you're on mute.
Someone had to do it. Kenneth said it perfectly. Thank you everyone for having us.
Okay, well, if we did not get an opportunity to answer your question, or if you have questions after the webinar, Questions and feedback are always welcome at bhidd.helpcenter@dhhs.nc.gov. The recording and presentation slides for today's event will be posted on our Community Engagement and Training webpage. The links are included in the chat box. There will be a brief survey following today's webinar, and we would appreciate your time completing it. Our next side-by-side webinar is scheduled for Monday, June 3rd from 2 to 3. This concludes our webinar for today. Thank you for attending.
Thank you. Bye-bye.